Welcome to the world of stroke in Australian hospitals. Key performance indicators of acute stroke care have plateaued for several years. How is this so? Stroke care is complex. The challenge is getting all the right things done to a stroke patient at the right time. For too long, we have been improving processes in a non-digital world that is seemingly digital. It is far too much work for our teams to handle any longer. Junior doctors, nurses, and allied health cannot be as effective as we need them to be without the support of technology. The rate of improvement in any system process is related to how frequently an action is measured and acted upon. Our current clinical improvement systems are slow and outdated. They are insufficient to keep up with the complexity and volume of care our hospitals provide, but simple information technology can make things better. EMR products have failed to truly integrate their systems into the clinical workflow. Junior doctors are critical to the performance of our system. We easily forget that they lead the bulk of acute stroke care on a day-to-day basis, and this typically occurs in a semi-supervised and chaotic environment. It's a problem that by the time rotating junior doctors become competent, they move on to another specialty. The high cost of acquiring quality data must not be the new norm, and yet hospital organizations expend far too much on capturing data. We want to convince you that it can be done cheaply and efficiently. We present to you Rounds. Think of Rounds as a multifunctional clinical support tool rolled into one. It helps doctors document every clinical encounter. It provides advice where it is needed to help patients receive best care. Helps doctors coordinate ward jobs and provides effortless data capture and service monitoring. Rounds operates as a layer between the medical team and the electronic medical record. Every clinical encounter is documented through Rounds, and that means the admission, the ward round, and the discharge. Rounds then automatically transmits a legible and neatly organized snapshot of that clinical encounter to the EMR. If a stroke patient comes through the door and needs to be seen immediately by one of our junior doctors in neurology, this is the starting point. We wanted to support our doctors with a standardized, comprehensive admission template for all acute stroke and neurology presentations, capturing important information such as time of onset, a deconstructed and reorganized and complete version of the National Institutes of Health Stroke Scale, and investigation results. The final page starts with selection of the admitting neurologist, provisional diagnoses, and then guideline-based management plans tailored to the diagnosis so that nothing is forgotten or missed. The end product is a beautifully laid out, comprehensive admission that is landed in the EMR as if it was typed there directly. It covers every aspect of the assessment. We've covered the ward round too. We can rapidly allow junior doctors to document clinical progress, discussions with the patient and their family, and to be able to definitively document secondary diagnoses and discharge plans as they are decided through their hospital stay. And again, the progress note is transplanted directly into the EMR. At Gosford Hospital, it took no time getting used to the fact that discharge summaries no longer take an age to complete. Why? Because the discharge summary is all ready to go. Real-time visualization of patient-level data is critical to the clinical leaders in each stroke unit. This is our patient dashboard. This is commanded by senior nursing and physicians. Know right away who is in the stroke unit and understand where the patient is in their journey. Have the right things for this patient happened? Can they be stepped down to a normal bed? All that and more can be known immediately through rounds. If a patient hasn't received the right treatment, you'll now be able to know immediately. In 2017, 67% of patients nationwide had access to a stroke unit, 69% for the state, and 76% of our patients went to the acute stroke unit. In the last 3 months, this is now greater than 95%. Indicators of care preparations for discharge have improved as well. Education for behavioral change, for risk factors, 15% in 2017, steadily improved to 80%. Discharge on statin, antihypertensive and antithrombotic for all ischemic strokes, 83% in 2017, improved to 98%. Discharge on oral anticoagulants for atrial fibrillation, 50% in 2017, now 98%. Rounds facilitates better documentation accuracy. We found that more of our neurology patients are now being coded correctly as stroke, with an increase by 21%. This is also with a steady and unchanged number of admissions to our service. With an understanding of what our platform does, it is easy to see that our system is promoting the documentation of a diagnosis at every stage. Understanding diagnostic coding is key in improving funding for your service. All stroke admissions fall under the following categories: B70A, B, C, and D. It is also important to know that increasing care utilization is seen from D all the way up to A. Rounds organizes care such that we are seeing a shorter length of stay. Patients with B70A are generally severe strokes with multiple complications requiring a longer hospital stay. We saw a 17% improvement in this group and a 40% improvement in B70B patients. Rounds is helping to upgrade coding categories for stroke episodes. With a 127% increase in B70A and a 75% increase in B70B. Rounds is helping our unit get more funding for the same amount of work. We saw a 47% increase in national weighted activity units for a 3-month comparison period year on year. This is extremely encouraging because deploying rounds will likely save hospitals money. The most important time for a stroke patient is in the emergency department. Rounds covers the management of our patients by our care teams from their acute presentation to discharge. We saw there was a desperate need for some immediate guidance right at the door for ED doctors managing acute triage. We build a triage screening and assessment tool that does the following. Number 1, guides the clinician through a brief but comprehensive assessment of their suitability for reperfusion therapy. Number 2, guides the clinician through the next necessary steps. Number 3, all of this is easily documented. One of the most exciting features of our system is that clinical data we collect is a byproduct of the work that it coordinates. It allows us to see the performance of our system in real time, and this data can be exported anywhere, even into a simple Excel spreadsheet. What can Rounds do for your hospital? It will improve the quality of care to patients. It will improve the funding to your service. You will have complete clinical data at your fingertips. It will make your teams happier. You might find yourself watching this, asking yourselves, why did we build Rounds? Well, it starts here, with our patients and the junior doctors looking after them. Like all clinicians involved in stroke care, we have all seen what excellence looks like and the outcomes this can produce. Unfortunately, we also have seen what happens when the system falls over, and we all have mental anecdotes of disasters, having seen with our own eyes where patients have missed out on care that could have made all the difference. As junior doctors ourselves, we experienced the gaps that existed as we struggled to put our knowledge into practice. Learning the hard way, the expertise needed to deliver stroke care, all the while shouldering the pain that comes with failing the patient in front of you. With consumer technology exploding in other areas of our lives, building a platform to bring our systems truly into the digital age was the only way forward. Creating a platform that allowed junior and less experienced staff be supported and play a critical role in the care team became our mission. We have focused on building the tools that will introduce a new generation of doctors and nurses to a complex, time-critical but rewarding area of acute medicine. We present to you Rounds. For more information, visit drozetmedical.com.au.